Hello, this is Glenn Gruby, and today we're going to talk about thyroid and depression. And these two things are quite interwoven. Depression is actually a common side effect of thyroid disease, and it's often mismanaged when the thyroid is involved, and you're going to learn why today. So first, let's look at some facts on depression. 17.5 million Americans are affected. A lot of people are affected by depression. 66% of those with depression do not seek help. And part of that might be because they don't even know they have depression, something that can set in slowly over time. The economic cost to the nation is over $30 billion per year. Women are twice as likely to have depression as men. It's a hallmark symptom of low thyroid function. Your brain needs thyroid hormone to function properly, and without it, you have trouble making and using some of the neurotransmitters. We're going to talk more about that today. Nutrition, epigenetics, environment, and stress are all key factors. So really, it's not as much a genetic thing as it is a lifestyle, nutrition, environmentally related issue. So we're going to see how your environment and your lifestyle and your nutrition status all play a role in this. So what is depression? Depression is a whole body illness that affects a person's physical health as well as how he or she feels, thinks, and behaves towards others. In addition, a person who suffers from this disorder may have problems eating, sleeping, working, or getting along with others. And clinical depression is a persistent depressed mood that is often characterized by feelings of sadness and emptiness. So it's very connected to the thyroid, as I said. It plays a significant role in depression since it impacts several organ systems in the body, specifically the brain. Thyroid hormone dysfunction impacts all neurotransmitter receptors in both men and women, and there's a lot of neurotransmitters, but the two we're going to talk about today are dopamine and serotonin. Thyroid function affects brain inflammation, plasticity, neurotransmitter activity, and general brain function. Brain inflammation is a big thing to consider because when you have inflammation in your body and your brain, you're actually killing your brain. Brain cells die. The thyroid plays a vital role in dampening this brain inflammation, so if your thyroid is not working well, you're going to have increased brain inflammation, and unmanaged thyroid dysfunction will lead to a faster progression of brain degeneration, memory loss, and cognitive decline. And I've seen this in my practice where I have patients that maybe didn't know they had thyroid disease or didn't manage it properly, and then later on, after some major stresses and changes in their life, that led to some brain degeneration. So it's really something that if you have thyroid, you want to look out for. You want to protect your brain. You can take thyroid hormone to replace your thyroid, but there's nothing we can give you to replace your brain. So we have to catch it before it becomes a major problem. And as I said, the two main neurotransmitters we'll focus on are serotonin and dopamine. So let's look at the functions of serotonin. It's found in both the central and peripheral nervous system. Serotonin in the central nervous system is associated with functions such as anger regulation, body temperature, mood, sleep, vomiting, and appetite. And in the peripheral nervous system, it's associated with gastrointestinal motility, pain modulation, vasoconstriction, and a promoter of cell division. So two things. First, serotonin is made in the gut and in the brain. 90% of it is actually made in the gut, and it does regulate your intestinal motility. So low serotonin, you will see constipation. But the name serotonin, sero means blood, tone, tonify. So really it was originally thought of as a blood tonic in the sense of helping control the blood flow in your body. And it helps to increase and decrease blood flow depending on the levels that it is. So some symptoms of low serotonin are shown here. And we think of serotonin as the feel-good neurotransmitter. When you have enough serotonin or the right levels, because some research actually shows too much can be a problem as well, you feel good, you feel happy, and you enjoy life, and you appreciate others. And when you don't, then you start to not feel so happy. You lose interest, you feel sad, you feel lack of joy, you don't enjoy your foods, you don't enjoy your friends. And so we're going to see how the thyroid can affect all this. So let's look at serotonin production in the brain. So as I said, most of the serotonin in the body is made in the gut, but that cannot make it to the brain. Serotonin in the brain has to be made in the brain, and it does that by allowing in an amino acid called tryptophan into the brain, and through the action of iron, that gets converted into what's known as 5-HTP. And so this is why iron is so important for mood, and if you have low iron or low stores of iron, low ferritin, you may be more likely to have mood issues. Let me state here that 5-HTP is used in natural medicine to support the production of serotonin, and it's safer than using tryptophan, and in studies it's also been compared favorably to conventional drugs like SSRIs without any of the side effects. It's been quite effective for balancing mood. So this 5-HTP then has to be converted directly to serotonin, and it requires the minerals and vitamins B3, B6, B9, B12, and magnesium to do that. So you want to make sure you have enough iron and B vitamins and magnesium in your diet. If you're missing any of these, you could have a problem. So the nutrients I've shown here in red are also required for thyroid hormone production, iron, B3, and B6. So somebody that is having a thyroid problem might be low in these nutrients, and that can also be affecting the production of serotonin. So next we're going to look at dopamine and the functions of dopamine, and it has numerous functions in the brain related to motor coordination, motivation, and reward cognition, regulation of prolactin, mood, attention, and learning. So one thing in the disease Parkinson's is a dysfunction in the part of the brain that produces dopamine or processes dopamine, and you get the movement disorders. Dopamine is associated with the pleasure system of the brain and promotes feeling of enjoyment and reinforcement to motivate performance, physical, and psychological arousal. So we think of dopamine as the motivation neurotransmitter. When you feel like you can go and conquer the world, you feel great, then your levels of dopamine are probably okay. So symptoms of low dopamine are the opposite of that. When you just feel worthless, you don't feel like you can conquer the world, you feel like you can't do anything, and you feel like you don't want to be around others, maybe you can't finish tasks. Chronic procrastination can be a symptom of low dopamine, or you just can't finish projects. You can't motivate yourself to finish projects. Interesting, cravings for chocolate, because chocolate raises dopamine levels in your body. So how is this produced? So there's a different starting amino acid, tyrosine, gets into the brain and uses iron to convert to dopa, and that gets converted to dopamine via B6. And tyrosine, iron, and B6 are also required for thyroid hormone production. So something important here is that when your brain is inflamed from stress or gut problems or toxins, then tyrosine gets shunted over to make more inflammatory chemicals in the body, and it's less able to make dopamine and thyroid hormone, which is why inflammation, which we talk about so much, is such a big problem as a root cause of many chronic conditions. Of course, today we're talking about thyroid and depression. So what are some of the risks for depression when you have a thyroid condition? Key factors that can cause those with thyroid disease to suffer from depression are poor dietary intake. So if you're not giving your body the nutrients it needs, it can't function the way it's supposed to. But this also depends on good digestive function to absorb these nutrients. People with hypothyroidism usually have low stomach acid, and stomach acid is needed to absorb certain nutrients like proteins and iron. So you could have low stomach acid, you're not absorbing your iron, and it interferes with your ability to make neurotransmitters. Specific nutrient deficiencies, which we talked about, exposure to blue light, kind of like electronic devices, and it's really a good idea to turn off your electronic devices, say after 9 o'clock at night, because it does disturb your sleep, and having good circadian rhythm, good sleep patterns is very important to your ability to replenish your neurotransmitters. Excessive stress and worry can cause inflammation and raise your cortisol levels, which can then affect your brain. Poor management of thyroid health can cause depression, because if your thyroid isn't managed properly, you could be taking a thyroid hormone, but your body might not be able to utilize that in the active form, and therefore your brain would suffer. Or if you're not addressing nutrients or other aspects of thyroid metabolism, that I would actually expect to see depression. Poor management of depression. So if you have not had a thorough history taken and you're just given, for example, an SSRI, but you have a dopamine problem, that may not work because it's the wrong drug. So you always want to assess your basic body needs first with nutrients, digestion, blood sugar balance, sleep, stress-related issues. And often by correcting some of these issues, the depression will resolve itself and the need for the medication would go away. Chronic inflammation is an issue because it degenerates the brain and it affects the way your cells and hormone receptors work. Chronic inflammation is a major cause of depression. And finally, not knowing where to turn for help. It's really important that you find someone who knows how to address all these aspects of your life that may be affecting your health. You need someone who understands how your body works and who can give you a game plan for how to correct these things. That's what we do at FHAI, and it's part of our mission to help people understand how your body works and so you can give it what it needs and help it to start working better for you. So finally, what can you do? Some simple things to think about. First of all, you want to reduce your stress because stress is a major driver of inflammation. Things that I found to be good for this are meditation, acupuncture, getting the right nutrients when there's something missing. Nutrients like magnesium can be very helpful for stress, and also specific herbs. Second is fix the gut if there's a gut inflammatory problem, and we talked about this in our leaky gut video. That is something that is very important to do. Third is you want to address sources of inflammation that may be affecting your brain, and this includes environmental toxins and food sensitivities, which are really food toxins, and stress-related issues. And you want to lower brain inflammation, and we can do this with certain herbs and nutraceuticals as well. And fourth, you want to detoxify the body, because if there's a very toxic condition and the liver is not able to process that, that just feeds back into the inflammatory loop and makes things worse. So I hope this was helpful and gave you some ideas on what you can do to significantly improve your health. Like I said, it's a big problem because there's a lot of depression in the country, and I don't think we manage it as well as we could. If this was helpful, I'd encourage you to share this video with others. And if you have any questions, as always, look us up online or give us a call at the office, 856-321-9301, and we'd be happy to discuss your case for you.